Hey everyone, Jamie Pripp here, back with another video about Medicare and your retirement years. And I came across this article today, and it actually connected to a conversation I had with someone this morning, quite honestly, about how much will you spend in your retirement years on healthcare. And it's an interesting question. And there's another study out there, I believe it's by Fidelity, that you can Google, that they have found that for a married couple will spend on average around $300,000 on their health care after 65. Now that's combined. And so I came across another article that was actually published a few days ago here on USA Today and wanted to bring it with you as well. Thanks to everyone who's subscribed to this channel. I really appreciate it. If you haven't subscribed already and you like learning about your finances in the retirement years, especially Medicare, I'd love to have you subscribe to the channel, like the video, leave a comment if you have a question. And as always, share it with a friend. So, the title of this article says the average retiree spends 30% of their Social Security income on healthcare. And so, this is definitely healthcare is definitely something that you want to take into consideration when you are budgeting for your retirement years. And so, if you go down through this list, what you'll find is that there was a report done by AARP. It was actually just released in 2021, so just a couple months ago. And it said that retirees with traditional Medicare end up spending on average $6,168 per year on covering the costs of insurance premiums and medical services. And the reason that this is important is because the average Social Security benefit in 2022 is just $1,657 a month, or $19,884 a year. And so if you take those numbers into consideration, that comes out to just over 31% of your Social Security check paying out of pocket expenses. And for many people, this can come as a big shock. And so, especially if you were counting on Social Security as your main form of income. So, as you skip down through this article, you'll learn a couple things. Obviously, they're encouraging you to shop around during Medicare open enrollment. They're talking about Medicare Advantage plans in this article, or what a lot of people do is traditional Medicare and a Medigap, or also known as a Medicare supplement plan, and to help cover the gap. So I think the person who wrote this article, when they're giving us this number of $6,168, I don't know that it says here specifically, but I think what they're saying is if you just have traditional or original Medicare. So there's some ways to offset that cost, whether it's through a Medicare supplement plan that you add to traditional Medicare, or adding or switching to a Medicare Advantage plan. I've done some videos about both on this channel. You can certainly look through it and hopefully learn a little bit more. So the thing I want to highlight here is this Medigap plan. Okay, so a lot of people, when they come into the Medicare program, there's two things that they're surprised of. One, it's not free, right? For most people, they don't have to pay a Part A monthly premium, but there is a deductible, and Part A is your hospital. So if you go into the hospital, there's a deductible with that. But more importantly, Part B, like boy, has a monthly premium. And so every person, regardless of how you decide to receive your benefits, has to pay that monthly premium. And the second thing that people are surprised about is that Medicare only covers 80% of your potential healthcare expenses. So there's a 20% gap in coverage that you are exposed to unless you do something differently with your benefit. And there's no cap on that. And so the illustration that I like to use a lot of times is my father-in-law, who's on Medicare, has had to do not one but two, I think at least two medical helicopter rides. I don't remember what the total was, but let's just say for the sake of this video and for illustration purposes, let's just say that it was $10,000. Medicare would pay eight, and he would be responsible for two. That's just a general illustration. And so that supplement, or also called Medigap Plan, is what covers you from that exposure. And then it just goes on and talks about if you're not retired, what are some things that you can do. It talks about a health savings account to prepare. Talks about right here, talks a little bit more about just some of their own opportunities to better yourself for the retirement years. But this is just an interesting article I wanted to share with you today about, again, this is just about how much the average retiree could spend of their Social Security income on healthcare. And so you do have some options available to you to remove some of that risk. If you'd like a free consultation, you can give our office a call at 800-974-0552. I'll put a link to our website as well as that phone number in the description of this video. So hope you enjoyed this video. If you did, please hit the like button. If you want to see me cover another topic in the future, leave that in the comments below. And again, if you know someone who would enjoy this video, please pass it along to them. So thanks for watching. See you in the next one.